I've known Moira for the last couple of years because she's been working very closely with us on this national survey that we've been doing during the pandemic of households and of early childhood educators and providers. She's actually a member of the National Advisory Council for the child care survey. Moira is also a senior VP of research interpretation at FrameWorks. And in that capacity, she focuses a lot on efforts to interpret and share communications science with the nonprofit sector so that it can drive social change. And as we were talking about before we officially started, this is really serious business. That is to say, I think there's lots of lip service and aspirational talk about making science more accessible to the general public. And at the same time, that process is not as simple as like just ratcheting down your vocabulary or something like that. One of the things that's super cool about FrameWorks is that they have a scientific methodology that they employ in the process of developing communications that's as systematic and rigorous as any kind of research of the type that I think you're more used to doing if you're connected to the Center on Parenting and Opioids. So Moira is going to be talking some about that, I suspect, with respect to the topic of the P50 Center. Just in the way of background, Moira's a sociologist by training, and she is particularly interested in the way in which framing can either help or harm advancing social movements and social change efforts. She's also, before working at FrameWorks, she worked at the Vera Institute for Justice on projects related to immigration policy, and at the Institute for Scientific Analysis on issues related to substance misuse and drug policy. So she is very well qualified to be joining us today and sharing her thoughts with us on these topics. Welcome, Moira. We're thrilled to have you.
Well, thank you, Phil. Thank you for that introduction. And thank you to Camille and Ashley, especially for inviting me here and for doing so much to make this just as smooth a process as can be. So thank you both. Let me share my screen so we can get going. Here we go. So today what I'm going to talk about is some sort of the intersection of a lot of work I've been doing, and I'll talk about all of the bodies of research that I'm going to draw on to talk about some of the recommendations that we have around framing, especially issues related to harm reduction and parenting. I really appreciate the opportunity to be able to talk to you all today and to share some of this information and to just hear how it lands with you, how it might pertain or be applicable to the work that you all are doing. I started off my research career working on a national study of women who were using drugs while pregnant and sort of a life history interviews with women. And so this has been parenting and how people parent and how that relates to their decisions around drug use has been a topic that I've been interested on in drug policy reform. Is something where I sort of spend a lot of my own personal political energies and has deep personal meanings. So I just want to start out by thanking you all for the work and the research you do. It is so, I think that the topics that we work on all are very important, but sort of changing people's ideas about people who use drugs, what happens when people are parenting is so critically important and can be so impactful. So I just want to start there. But what I would like to do as a first sort of exercise, and I'll give you a moment to take some time to think, but I want you to want to start off with sort of an aspirational vision of what is the world we want to see. So if you all can think about, like, if you were to open, I know nobody opens up a newspaper anymore, but if you were going to turn on your phone and see a headline about the issues that you study related to parenting and opioid use, what would you want to see? So think big, go for go for the stars. What's the kind of change you want to see in the world? And if you can share your headline in the chat, and again, I'll give you a couple of minutes to craft those headlines. So I'm seeing, Leslie, that's great. Racial disparities in pregnancy-related deaths obliterated. I'll give you guys a couple of minutes to share your headline. Positive parenting possible. Very good, Phil. I'm gonna stop my sharing for just a second. I'll just go so I can see the chat. I'll give you guys a minute more. So I'm seeing headlines about the how if we support parents, we can sort of avoid the overuse of the child welfare system. Community-based approaches to developing interventions for parents who are affected by substance use greatly improve dissemination and implementation. Fantastic. More real focus on racial disparities. So culturally grounded integrated treatments for trauma recovery and substance use are highly effective for Black mothers. This is great. Okay, so I am gonna, this is wonderful. I start with this exercise because, you know, I think it's good to sort of start with the vision of what we wanna see, but also to just make the point that when we think about social change efforts, that, you know, obviously a lot of work has to happen. There's research, there's advocacy, there's movements, there's grassroots movements, but the language we use and the framing decisions we make are critically important as well. They're an important piece of that change happening. So really thinking about where do we want to go and how might our language choices help us get there is some of the work that I want to share with you and talk to you about today. So just a little bit of information about FrameWorks. We are a nonprofit we have a lot of ways of describing ourselves. So you would think we would get a little bit more succinct and adept at doing this, since given we are a communications research think tank. Um, but what we do is we spend a lot of time with people who share some kind of expertise on a particular issue. And I'll give you some concrete examples of these. But feel that that knowledge, a valuable resource, is not making it to, outside of their maybe small professional circles. So members of the public don't have access to it. It's not necessarily informing our policy decisions at a sort of a consistent and high level. And so what we do is we partner with folks to develop ways that they can effectively translate that knowledge and that research. And we do use the word translate very intentionally. And I will show you a bit of what that looks like. But the idea, as Phil said, it's not that we encourage people to dumb down their science or to simplify their research, is to really take that translation process. You, by virtue of the rooms that you get to sit in, the privilege that you have to do the research that you do, to be in the places that you are, you know a lot about the things that you're working on. And what that does is it makes you slightly different than people like myself, who don't share that expertise, members of the public who don't have access to that expertise. But one of the things that I think is really important in the work that we do is that even if we don't have access to the science or to the research, we nevertheless have very complex ways of making meaning of those topics, and deeply understanding how people make meaning of specific social issues before you even think about how you're going to translate that or how you're going to communicate that, is a real important part of our process. So it's, thinking about two languages and what we can do to sort of better bridge some gaps in communications should we see that they're happening. So we do the research at FrameWorks, and then I spend a lot of my time increasingly making sure, translating our own science, making sure that whatever we find out in the research process is usable and actionable for folks on the ground who are trying to communicate for some kind of social policy systems level change. And we do that in all kinds of ways, by engagements like these, where we're sharing our research and seeing, talking to folks about, what might be useful. We do a lot of one-on-one work with groups, and really try to, live by our own sort of organizational mandate to make our research usable and accessible to folks. So today I'm going to draw on a lot of different bodies of research that we have done that are sort of intersect with issues related to parenting and drug use and opioid use. I want to talk a little bit about the research we did with the Open Society, was funded by the Open Society Foundation, on harm reduction, because I think to be clear about the sort of perspective that those recommendations come from. So OSF funded us to work with a group called Reframe Health and Justice, and also to have a lot of contributions from folks who work at the Drug Policy Alliance, to figure out ways to communicate about harm reduction that sort of adheres to more community-based principles of harm reduction as the movement, not just a public health approach. And I'll say more what I mean about that. So the people that we interviewed that provided us our expert story were getting increasingly, I don't know if distressed is the right word, but concerned that as harm reduction becomes an approach that has become more mainstream because of, a lot of the evidence that sort of backs up the approach, that in some ways, again, the folks that we were working with were feeling as if it was losing something of its original sort of the original movement, which is sort of the radical centering and the radical recognition of the humanity of people who use drugs. So that people would talk to us about we'll talk about harm reduction practices, like, let's say, needle exchanges. But the rationale for those exchanges would be to keep kids safe from needles that might be on the street. And for the folks that we were working with, that was sort of, I don't know, a bad adaptation of harm reduction, because it's about protecting kids from drug users, again, not centering the dignity and humanity of people who use drugs. So I just, that that's the work that we were doing, with the Drug Policy Alliance and the folks at Reframe Health and Justice. So really fascinating, and I'm happy to talk about that more and answer more questions. But just to be clear about the perspective that reframing of harm reduction was sort of grounded in. As I'm not going to go, I'm going to, as I talk through some of these examples, I'm going to talk about the high level recommendations. I'm happy to answer any and all methods questions. I'll just talk at a high level of how we set up our research projects. So as I said earlier, it's really important to us that we are really clear about what a field, an area of study, a sector wants to say about the thing that they're working on. We often do not have substantive expertise on those issues, so we rely heavily on our partners to figure out what are the messages that, what are the ideas, what are the core concepts that need to be translated. And again, I'll show you an example. Spend a lot of time talking to people about how they already think about that issue. So as Phil mentioned, we've spent a lot of time working on the issue of early childhood development. So people may not know a lot about the brain science, but everyone has ways of understanding how children develop. So really understanding those common patterns is critically important. What does the media environment look like? What is the field saying about that issue? And at that point, we sort of have a good map of what needs to be reframed. What's the sort of prescriptive research that we need to do to be able to provide that field with effective framing strategies. So we rely on quantitative and qualitative methods to be able to, come out at the end of the process and say, here's a metaphor, it's called toxic stress, and it's doing a lot of the translation work that you need it to do. And it's also deepening people's knowledge and sort of deepening their understanding of the kinds of policy implications that come from that science. A much simpler way to say what I just said is, our descriptive research is to really think about how people are thinking about an issue now. And when we're framing, we're thinking about how to spark new thinking. So I think something that's really interesting for those of you who have any familiarity with other kinds of communications research is because we're interested often in new thinking, right? Can you understand something that you didn't have access to before? Can you think about this in terms of a more sort of a collective orientation to the problem? Can you start to think about what are the kinds of systems and policy changes that might need to be put in place in order to better support people, to improve outcomes for folks? That often the measure of resonance, right? Do you agree with this message or do you like this message is not what we're looking for. We're looking for those shifts. And so I think that's an important thing for you all to keep in mind as I present some of the findings and recommendations. Often people don't like the framing strategies, but it's not that we don't care what people like, but what we're really looking for is can it really change the way that people are, the tools that they have to make sense of that issue, and especially can they see the systemic causes of a problem, and also how we might change things at the systems level to better improve outcomes. So one of the ways that we talk about that difference in understanding is, for any of you who've taken an intro to sociology class, you have likely had to read the sociological imagination. But it's really the idea of reframing issues so that we're less focused on what's going on inside of the individual, the sort of, thinking about social problems as a problem of character or morals or willpower of individual people, and rather thinking about the context and the environments in which social problems are happening, and really giving people the ability to tell more sociological studies about sociological stories about the issues that they're working on. So one of the ways that, I'll just talk briefly an example about some of the work that we've been doing. Phil is very familiar with this work. But as we started to work with the National Scientific Council on for the Developing Child and the Harvard Center for the Developing Child, one of the big shifts that we thought was really necessary because of our research, it was to really move the field away from a vulnerable child frame. And the reason that we found that particular frame was, I'm going to say harmful, was that if I go out in the street and I stop people, we don't do this on the street anymore. Now we do on the screen interviews, and I stop them and I say, there's a vulnerable child. Can you talk to me about why they're vulnerable? What I'm going to hear is highly stigmatizing talk about parents and what they are doing and what they're not doing. And if I were going to get to solutions about, what do we do about vulnerable children? We're going to hear a lot of punitive approaches, right, to what we do to parents. And so the kind of big framing shift that we have been working with, early childhood researchers, advocates, practitioners, for the last 2 decades, is to really take it out of the vulnerable child and talk to people about what's actually happening in the brain. In some ways, it's to sort of radically depersonalize or depersonify the story, so that it sort of stops people from all of that, again, that judgmental and stigmatizing sort of approaches to parenting when we see, or we're thinking about young people experiencing some kind of challenge. Phil, did you?
Yeah, I just wanted to amplify what you're saying, Maura, that as a clinical psychologist and somebody in working with vulnerable kids, the entire way that I was socialized as a scientist to talk about these issues in all of my introductions of papers, in any kind of public talk I give or gave, was to start by talking about the scope of the problem. And that's sort of the standard way that we communicate. And I have to say, one of the biggest changes in my whole outlook was the result of some of these conversations with you and your colleagues. That is, and it still is something that I have to think consciously about every time I talk. But the idea that you don't start by saying there are 6 million children in the foster care system in this country, who, if left unattended to, will have the most bleak of outcomes that you can imagine. Like, that's how we get people's attention. And so I just want to sort of note what you're saying for those listening, that what you're saying sounds common sense, but when we really think about the way we're socialized to communicate about social problems as scientists who are interested in addressing them, what we do, according to your way of thinking about this and the research you've done, exacerbates the extent to which people think there's nothing can be done. And so it actually has the exact opposite effect of what we often intend. And with the population that we're here to talk about, that is just so incredibly important. So I'll shut up, but I just wanted to make the obvious even more obvious to people.
Well, and I mean, and first of all, thank you for raising your hand. Please, I want this to be sort of an open discussion. So please, anytime anybody has any questions or comments, I invite you to talk. And you're still, the genres that you have to write in, right, still force you, even if you have, I want to do it another way, how you write grant proposals, how you have to set up your arguments for, journal publication. It is the problem statement that you have to lead with. So it's there's definitely institutional sort of constraints on, especially academics' abilities to reframe. But I think it's really important that you might get people's attention with those statistics. They might listen, but is listening enough, right? And if you're just sort of contributing to that sort of general sense of fatalism about these issues, like I'm listening and I'm horrified, or I care, but what are you going to do about it? So really, one of the things I want to talk about today is to really, really think about what are the outcomes that you want as a result of your communications. And I'm sometimes attention is not enough. Sometimes empathy isn't even enough, to get people to the place of, how do we change our policies and systems to better support parents, no matter their circumstances. Um, and I think that this particular, and I open this up to discussion when we're talking about parenting and opioid use and drug use. We all, for those of you who were alive and news attentive during the crack epidemic, the horrific stories that we would hear, women being chained to hospital beds, forced to give birth, because they tested positive for drug use, the sort of just awful things that have been happening around drug policy, especially to pregnant women. There's, and again, you guys are probably better. It seems like we're seeing a bit of a resurgence of some of those practices, and again, you all can probably talk a bit more why that is happening. There's been a lot of talk about how we are addressing the opioid epidemic in much more humane ways because of the racial composition of people who are using opioids, but we're still seeing a lot of punitive and incredibly stigmatizing language around people, especially women who use drug while pregnant or parenting. And again, that when we focus on social problems as the result of willpower or moral failings, even inadvertently, that often leads people to the ideas that the solutions have to be punitive, and that's how we make change positive happen. Went the wrong way. Oh, still going the wrong way. So Ashley, if it's okay, if we can just I want to spend a little time in maybe 7 or 8 minutes in breakout rooms. And if you guys can just have a conversation about some communications challenges that you have when you're out in the world talking to people who do not share your expertise, about parenting, drug use, parenting, opioid use, and if you want to talk about your experiences talking about harm reduction, that would be great too. But if you don't know the people in your room, introduce yourselves, because even if you do know them, sometimes people forget your name, so that's always a polite thing to do. And then just have a conversation about what you feel you're up against, and then we'll come back and talk as a group, what you all talked about. And Ashley, we're all good? Okay.
Good to go.
So we'll give them like 7 minutes.
Okay, got it. Thank you.
I'm gonna stop share for when people come back. It's so, for Zoom, we used to do things like this in person, and it's just, you can't talk at people for like, so just the way that I break things up. And
Yeah.
I mean, I think I should have been doing that when I'm in person, but you know, I think it's especially important.
Mhm. No, I like this too, you know, during a presentation and some involvement and whatnot. I think this is, yeah, definitely great. Okay. I'm going to give them a 1-minute countdown too.
Okay, great.
Okay, they just got 1 minute.
Okay, great.
Too funny. Some of our data is on a little Dell computer and it just warned me that rain is coming. I didn't even know it had a weather app on here. Dells are fascinating.
Okay, welcome back. I hope you you got the got enough warning to wrap up your conversations. I know that sometimes you get sort of unceremoniously ripped out of Zoom rooms, breakout rooms. But does anybody want to share what their group talked about in terms of challenges that you've had communicating about the work that you do?
Well, our group, we just had gotten into this topic, but we were talking about, maybe it was jumping ahead a little bit, about sort of message context, and understanding where, essentially where are the people that you're talking to, and what is the position that you're coming from, and that's something we certainly see with our community participants, not necessarily just parents, but people that are often, underserved, sort of, not engaged in research because of researchers, right? And so there's a lot of barriers to, what is their understanding of what this is all about, and where we're coming from. And so there's almost like a kind of cultural divide, and it's helping to really engage in the community. I mean, a lot of our studies now have community advisory boards, including the P50, where we're really trying to understand, where are people at, and trying to go to them rather than physically and also kind of conceptually.
Yeah, I think that is so critically important. Obviously, when you're doing sort of research that that's community based and focused, and when you're thinking about messaging about that research, again, even if people have been systematically excluded from that knowledge, we still have ways of making sense of information. And so really deeply understanding that, I think, is the most important step when we're thinking about bringing our science out to, again, folks who are excluded from it.
Our group talked about a couple different points. One was just around like how we even talk about the population, for example, that we're trying to reach in our work, when there's so much individual variability in how people narrate their own experience with substance use. So, are we trying to reach people who have been diagnosed with substance use disorder, or people who are in treatment, or people who are in recovery? And just knowing that individuals identify in different ways through this experience. And then we also talked about just stigma with harm reduction strategies or treatment strategies, as Camille pointed out to me. So like medication assisted treatment, and even for folks who may have that as a treatment option for them, there's so much stigma around it, that they may choose not to use that tool because in their mind, then they're still an addict because, they're using this medication that is similar to, some chemical substance that is impacting their brain. So those were a couple of the points that our group talked about in terms of framing.
Yeah, I think that one of the most challenging of parts of the work that we did, especially around the expert story around approaches to harm reduction, was getting folks to think about the language that they wanted to use to talk about first a spectrum of use, right? And then really trying to avoid evaluative language. So as you say, disorder or misuse or abuse all can bring kind of stigmatizing impacts, right? So one of the things that folks really focused on, and I would love to hear your response to this, is to focus more on functionality, right? How does your use impact you doing the things that you want to get done? And also letting the person decide how to evaluate how their use is impacting their functionality, which then is from a communication standpoint, talking about a spectrum of use and when supports are needed and necessary can get tricky. But even how do you call use that is impeding people from doing the things that they want to do that does not stigmatize that person, and I unfortunately I don't have a lot of answers for you, but it's a really difficult framing challenge. And Phil asked that if you guys could introduce yourselves and talk about your area of research, that would be great. I would appreciate it as well. Thank you, Phil, for that suggestion.
Maura, I think at least in our group, one of the things that came up was how fraught an issue this is to begin with, especially because there are kids involved. So, the extent to which parents having addiction issues, this applies in particular to use during pregnancy, but also beyond, that there's an immediate judgment call that's made about that. And I think I would just add to that, with respect to harm reduction, there's sort of this very well ingrained mythology in our culture about abstinence, and 12-step programs sort of being the only viable strategy for problems with addiction. And harm reduction, is such a sort of liberal sounding, like Scandinavian, like rehabilitate, not punish, that it just, like, those two things seem to me like part of the challenge with this topic is, as soon as you dip your toe in it, you're in this deep swamp of preconceived notions and values that people have. So you can't even raise the topic. Like, it's not like saying we want everybody to succeed, because as soon as you tiptoe towards the parents with misuse and addiction issues, you've sort of tripped the switch.
Yep. I think of all of the issues that we've worked on, I think this is one of the most difficult to thinking about framing solutions. I have some ideas that I'm going to share with you based on our research, but I think the level of deep cultural change that needs to happen and can happen, right, we have a long road ahead of us. But yeah, this is a tough one. Okay, so Camille, okay, everybody's introducing themselves. And so Leslie, you say the term harm reduction sounds so ivory tower to me. Do you want to say something about that?
Well, yeah. I think I was just listening to the dialogue you and Phil and others were having, and I think part of it is just even the words themselves, harm reduction. It sounds like something you read in a journal or something coming out of academia. It doesn't sound like a street term, a community term.
Yeah, and I also think that, one of the things, and I will send around this brief to you all, is that when you say harm, people automatically go to the psychopharmacological effects of the drugs. When, people who are working in harm reduction, they're often talking about other sources of harm, right? Racism, sexism, lack of affordable housing, all of those things. And so even the word, people have immediate associations with what you say when you mean, what do you mean when you say harm? That is, you've already tripped stuff off, as Phil said. And Kendall, to your point too, that even people, that sort of our cultural understandings of drugs, drug misuse, addiction, why it happens, how deeply it impacts people's, options for how they're going for treatment. If you use medical assisted treatment, you haven't gotten the willpower to sort of pull yourself out of whatever you were experiencing. That's how deep those cultural understandings that you might choose to not opt into, a modality of treatment that has an incredible evidence base, behind it. I think it's a really good point. And I, and we'll talk about this when we get to some of the recommendations. I think it also speaks to, I think, some of the challenges when people's communication strategies are really focusing on let people with direct and lived experience speak for themselves, and that being the strategy to build policy support, and sort of build public engagement for the kinds of changes we need to see. And I think it can be fraught, as someone with lived experience of these kinds of issues. It's nothing I want to talk about in front of a group of strangers. It's nothing I will talk about in front of a group of strangers. It implicates people I love, so I think there's a real serious danger of exploiting people and making them tell stories and re-traumatizing that they don't want to tell. Even people who have that lived experience live in the culture, right? And they have understandings of their own experience that is highly sort of highly individualistic in why they've experienced what they've experienced. So I think when we're thinking about narratives and who are the messengers, Elliot, to your one of your points, I think those are kinds of things that we need to be thinking about as well. Okay, anybody else want to share anything before let's get to some of the recommendations? And again, please just speak up if you have any questions. So the first thing that we, again, on across projects that we think about is to just deeply understand what you're communicating into. And I think there are two particular models of understanding most social issues, but particularly this one, that are very important for us to be thinking about and anticipating as we're crafting communications. So the first one is individualism. So the idea that if a person, even a group of people, are experiencing some kind of negative outcome, that is solely the result of the choices that they have made, and that those choices do not happen in a social context. So I'll show you some reels of people on the street sort of thinking through this model. We could spend the next 2 days together and I could show you reels of this particular model. It is so dominant in how we understand social issues, but I'll give you just a clip.
Starting off, I wanted to ask you why you think it is that some kids end up doing well in school and some kids don't.
I think it depends on the child.
It depends on the child.
Different people's minds work differently.
I guess I think that everybody's different.
Because kids have different learning styles and abilities.
Why do you think that some people have more difficult lives than others?
You work for what you want.
It's up to each individual as in themselves to really dictate where their lives are going to go.
Because you can't do everything for everybody.
You know, willpower seems to have a lot to do with it.
I think you got to believe in yourself.
It's the mind and the determination on what they want to do and whether or not they go for it.
I was in foster care and I'm still focused and I'm still on point, so it depends on the individual.
If someone you think has a leg up on you, then you just got to work twice as hard.
This will drive you more to succeed.
I believe that anybody can do anything they want.
What could be done to help more people do well economically in this country?
Well, I think people have to want to help themselves first.
People have to help themselves.
It still takes that individual person to want it for themselves.
Ultimately, how we pick ourselves up, and live our days is a choice in our hands.
I think it's all a part of the, attitudes and temperaments.
The failures are those that choose to fail.
You know right from wrong, it's a choice they make.
Some people, I think, make their own trouble.
I think some people make their lives more difficult by the decisions that they make.
Who's responsible for oral health?
You are.
I mean, you have to take care of your teeth, you have to take care of your mouth.
Okay, so as you can see, it goes across issue areas, and we all know this, right? you all hear these kinds of things every day. It's how sometimes we structure how we think about ourselves. I think what's important to think about is how, and not you all on this call, but often what we see is in people's communications, they are inadvertently reminding people of that highly individualistic understanding. So for the project that we were working on sort of how to communicate about harm reduction, we reviewed a lot of communications. And again, a goal in a lot of people's communications was to bring more attention into the larger social context and how that then sort of contributes to more problematic use. But in the communications, in the films that they have, there were all of the sort of pictures were really close-up pictures of people. In this case, it was about heroin, so people shooting up. But they wanted to talk about the context, yet the focus of their visuals was, individuals' behaviors, right, and their use patterns. So even though that wasn't the intended message, sometimes those communications decisions reinforce that sort of willpower narrative that we have about drug use in this country. So it's not that people don't know that that's something working against them. It's that sometimes people are inadvertently contributing to those understandings in ways that can backfire. The other, I'll stop there. Any questions or comments on that? Again, I know this is, as good observers of American culture, this is not news, but again, thinking about what it might mean for how you communicate to the public is important. Okay, the other big one that we're going to talk about is fatalism. So I'll show you a quick clip.
What do you think we can do about that?
It's a good question.
Literally, there is no way to make it better.
You got to piss the less of, two evils.
And once the damage is done, I don't really see it how they could really fix it.
Rent's going to be expensive no matter what. There's always been people complaining of the.
Okay. So I'll just show you a quick clip of that. And I think this fatalism, again, this is an issue where people's fatalism is even higher. There's an idea that, that once you even sort of, look at drugs, it is automatically, you are destined to have addiction and negative outcomes. And there's really nothing that we can do about it unless you help yourself. The other thing is that another sort of tendency or temptation is, especially when people want to talk about their issue with members of the public, with policymakers, is to really lean on crisis messaging. And there's a number of potential backfire effects with that. First of all, it's not that you aren't, doing research and working on a legitimate crisis, but then your crisis comes into competition with all of the other crises that we're dealing with, especially right now. So we have a reading crisis, we have a climate crisis, we have an obesity crisis. And if all of our messages are just about the crisis and we don't have that vision of how we move forward, you really tap into people's limited ability to engage in issues. People are living hectic lives, they're stressed, they might care about your issue, but if you can't give them a sense of what might we do going forward, that their ability to really come along with you in terms of how we change things can be limited by crisis messaging. Okay. All right. So here's just an example of some communications. This is about drug use and HIV infections, and just sort of an example of how, again, communications that the authors aren't trying to do this, but how they might be contributing to those understandings or ways of understanding the issue of drug use that might backfire, or again, not get people to the ideas of solutions. So I'll just give you a second to read that communication. So even if you look at the disease burden language, it really, again, that's not the intention, but the idea that it is the drug user who is responsible for what is happening. That, you know, we have at the very last sentences, we have balanced concern with hope and action. That's at the end, right? We have this we're sort of given a lot of discussion of the scope of the problem we have to wait for the hope and action, and we don't get a good sense of what that hope and action might be. All right, so how do we get, how might we combat that propensity to sort of fatalistic understandings of issues? And this sort of points to something that Phil said earlier, which is make the solutions the story. Make the program or the intervention, and I'm going to ask you guys to share some of that in just a moment, a real character in the story. So when I first started working at FrameWorks 15 years ago, this was before I had my own children. I've spent a lot of my time across the country working with early childhood advocates and practitioners. And I would hear a lot about their programs and services, and it was really difficult for me to sort of wrap my mind around what that meant, what it looked like, what were people experiencing, until I have a child with a developmental disability, and now a part of lots of programs and services, and I with sort of a light bulb, aha, this is what it means. People should not have to have direct experience of your solutions to have a really good sense of what those might look like. I want to just, let's actually not use the chat. Let's use our voices. If you guys can just talk to me about some of the solutions that you are working on, or that you would like to see implemented. And I'm going to stop share again so I can see your beautiful faces. Anyone want to talk about some things that they're working on?
Moira, could you clarify the prompt again?
Yeah, it's so if the idea is that crisis communications, or just talking about the scope of the problem, can lead to engagement, what are some of the things that you want people to be thinking about as effective solutions, or ways that we might better support parents who are experiencing difficulties with drugs? What do those look like? What would you want to see in place?
I think something that we're trying to convey with our work is that through promoting positive relationships, particularly with parents and their young children, that can buffer the family from stressful experiences that could be experienced from their larger environment or society.
So I'm gonna ask you questions as I would. So how do we? I'm gonna remember that. How do we promote positive relationships? What needs to happen? Don't people just have relationships? What do we do to make them, to promote relationships?
I think we would say that yes, like there are positive relationships. People have positive relationships, and specifically like parents and their children have positive relationships. But we want to draw attention to parts of that relationship that are particularly beneficial for young children.
Good. Anyone else want to share some things that we might do?
I think one of the things that I think about a lot is reducing structural barriers to access for people so that they feel like they have the resources they need to, to feel empowered to make decisions in line with their goals.
So what does that look like? What are some of those structural barriers that we would need
It
to?
depends on which population. I guess if I'm talking about parents, I would think about things like reducing financial burden on families, identifying ways to provide adequate health care without so many hoops to jump through to identify the source of what that healthcare could look like. To name a couple.
That's really helpful. And I mean, one of the things, I would never say don't use jargon, right? Sometimes we have to, but being able to have a way to define or describe or explain that jargon sort of in your back pocket, structural barriers, it means something to us, but it might not to people outside. But your follow-up answer, Camille, oh, okay. Now I know what you're talking about, and I can take that understanding that you just gave me, things like, financial burdens, and then map it on the next time I hear structural barriers to be able to have a deeper understanding of that. So we're going to talk about the importance of explanation, and often it doesn't mean you have to list everything or explain everything, but often one powerful explanation can help people for the next time that they come across some of the words that we use and we take for granted. So excellent job, Camille. Anybody else want to share? Okay, let's get to the, Phil, did you want to say something? I saw you unmute.
I just wanted to say that I think the idea that the relationships that Kendall was alluding to are hardwired, that they're part of who we are as humans, and that addictions don't preclude responsive caregiving. In fact, if anything, responsive caregiving can help people overcome addictions. And I think that's sort of, in some ways, part of the linking in is to figure out some way to combat the assumptions that if you have drug and alcohol problems, that it's incompatible with being responsive as a caregiver. And I think the harm reduction approaches are very much oriented to, well, given that this is on the radar, on the landscape, at the same time, these are the things that are most important to children. And these are things that everybody does well, that they come naturally, and that it does, even if you have problems with addiction, it doesn't rule you out of being able to do that. And that's kind of the feedback that we've gotten in our work with parents with addictions, parents who have kids in the foster care system, is like, nobody's ever told them that they could be good parents in spite of what's going on. So there's something, I don't think I'm hitting the nail on the head, but I think there's something in there that's transformative about thinking about the issue.
Yeah, and I'm going to get right there for some research I think thinking about this next finding I'm going to talk about, thinking about how that relates to what you just said. I remember, I don't know if you were there, Phil, but years ago when their now Palix Foundation was doing their early brain and biological development, Linda Mays gave a talk, and I was newly pregnant, and she played the sound of a young infant with the hunger cry. And it was the first, I had this response. I'm like, wow, I really am an animal, and I really am pregnant, because that cry just did something to me biologically that I didn't know was possible. But your ability to successfully address that cry and fulfill that child's needs, and how that helps in the recovery process, right? That if you're given the sort of environment, making mothers go away from their newborn babies to go to treatment has got to be the most inhumane thing we could ever do. But I think that's exactly right. I'm going to get to the next, show you the next set of research, and I think it really speaks to that being a key framing strategy that people need to do more often. Any other thoughts? Leslie, did you wave at somebody, or did you?
Sorry, people are, appearing in the office for the first time in a few weeks and they're waving at me. So sorry.
No, I'm sorry to call you out. And it's you see people in a work setting these days. It's wow, in person. I haven't had that experience yet. So I imagine I'd have a similar response. Okay, so let me get to the next set of recommendations. One of the things that we are finding across national contexts and increasingly is that when we talk about parenting, that making it about early childhood development seems to be a pretty effective strategy. So let me show you what I mean by that. This is some research that we did in Australia about communicating the science of parenting. And we tested two different strategies. One was to talk about the need for, knowing more information about parenting, because that improves parenting. That makes parents more effective. And the other message was, this is about, when we know more about, when we know more about effective parenting, it actually translates into better outcomes for young children. And you'll see that the message that this is about improving parenting, full stop, actually backfired in this particular experiment. So it depressed support for parenting programs. And this finding was statistically significant. And there's a number of reasons why that we found this. So first, there was an idea that the message was rejected because the idea, to your point that we're hardwired to have responsive to have responsive relationships, but sometimes that hardwired message is that this is just a natural process that doesn't need supports or practice or sort of things that might help us be the parents we want to be. That it's just a natural thing, so there's nothing we can do to support parents. There was also a lot of rejection of this message as paternalistic, like we, the scientists, are going to tell you parents how to parent. And instead, making it about child development really increased people's support for the kinds of programs that people wanted to put in place, and for the sort of the investment of public resources into these programs. So it is not that we want to support parents so that they are better parents. We want to support parents because we know that relationship is so fundamental to developmental outcomes. So I think that sort of the message that you were talking about, Phil, this idea that people have the capacity, no matter the substances they are using, to have these responsive relationships. We know how to support and to give parents the support and the time and the space, and to reduce the other harms, to make sure that they have the space to be able to engage in those kinds of relationships. We're talking about it through the lens of child development that tends to not have the same kind of backfire effects that we see when we talk about parenting programs as a way to improve parenting. Any comments or thoughts about that? Okay. The next recommendation that I want to talk about is, and I've alluded to this, is the importance of explanation in messaging. Often what we see, again, I know nobody on this call is guilty of this, is we see a lot of assertion and description of issues, and less of an explanatory story. And I'll give you some examples of what I mean by that. So, often you'll have a discussion of a cause and a consequence, and the mechanism, right, is missing. Then that miracle occurs. I want to show you, this was an ad that was put, this is so silly. It was put on the DC Metro to encourage people to take the Metro more. They're already on the Metro. Why would you put the ad there? But that's, I didn't lead this campaign. But even the message, more CO2 could lead to less coffee beans, keep the caffeine flowing, take Metro, the same message around beer. I get to talk to a lot of climate scientists, but it takes me a minute to make the connections between the things that are, the associations that are being made in this ad. This is really difficult to understand without more explanation. So I'm going to give you guys a pop quiz where we can sort of look through messages that are actually explaining and which are just describing. So you guys can just yell out A or B.
A.
A. Thank you, Leslie. That's the right answer. This one often trips people up because B has data in it, right? It has percentages. But what A has is the mechanism, right? Wages are stagnant and housing prices are rising. So minimum wage is causing this rent burden. With B, we just get the description of how many people are experiencing rent burden, but not the why. Do another one. A or B?
B.
B. So I think this is another thing that when we're thinking about communications with members of the public, the experience of discrimination is a very important factor that may explain people's reluctance, that does explain people's reluctance to seek medical care. It is not the only factor. But here, I think that having that mechanism is so important, because if not, what you've done is you've left that story open for people to fill in, right? And so they can take all of their pre-existing understandings of how race works in medical systems and fill in a story that might not be the story that you're trying to tell. So often, especially if we're working on things like the social determinants of health, it's really tempting to list all of the determinants. But often you're in a better position to explain one thing really well, rather than to provide no explanation at all. And again, the danger is not that it's going to go over people's heads. The danger is that they're going to fill it in with a story that actually does not fit with the story that you are trying to tell. Do one more. A or B?
A.
Yep, there you go. We have a mechanism, right? It's the stress of social isolation that is explaining the higher incidence of smoking among LGBTQ plus young people. So again, doesn't explain all the factors that are contributing to this inequity. It explains one factor, but again, we're providing that explanatory story. I want to show you some communications that we were working on when we were doing work on reframing harm reduction. So these are both taken from communications on harm reduction. One is description. It talks about, part of a harm reduction approach is thinking about affordable housing, universal income supports, universal access to high quality care. But again, people who are unfamiliar with the term or really don't already have a sense of how those things then can contribute to the harms that may be associated with drug use is very difficult. the explanation on the left, again, it explains something very specific, right? So how is it that housing policy impacts people's decisions about the drugs they're going to use, and then the harms that they might create? So, people without housing may choose to use methamphetamines because they can stay awake, they can stay alert, they can protect themselves from dangers that might come from living on the streets, from incremental weather, from all kinds of things, even though that might not, but it's the housing conditions that are sort of constraining those choices. Now, one of the things that you may ask, and is an important thing to ask, is, does an explanation require longer communications? And do we, not have the capacity to communicate in those ways, given that we're tweeting and so on and so forth? So first, you can provide more explanatory power in smaller communications. So those examples in the quiz I just gave are same size sentences, right? So you can think about that. But I also like to push back on the idea that we always have to be shorter. So I'll tell you a story of why I think we should think about how a compelling narrative can keep people's attention. So this was before the pandemic. My mom came to visit me over the holidays, and we were, as families do when they get together, we're drinking wine and we're talking about sort of sordid family history, and we're talking about my uncle and his ex-wives. And when I say ex-wives, I mean more than two, and these were characters, right? And so we're talking, we're getting a little mean, and I look at, she was 5 at that point, I look over at my 5-year-old, and her eyes are kind of looking like, what are you guys talking about? And so I stop and I'm like, I know we care so much about Uncle Terry, and we love him so much that we're just sort of processing this. And my mom says, we're just dishing the dirt. So for those of you who are younger, dishing the dirt was the metaphor we used to talk about gossiping before we started talking about spilling the tea. So my 5-year-old stays up way later than she can, just asking questions about family history. She goes to bed, gets up in the morning, climbs into my mother's lap, and she says, Nana, keep talking dirty to me. And so I tell that story because just to remind us that we do have a capacity to sit in collective spaces and hear good explanatory stories. We've spent the majority of human history in collective spaces dishing the dirt. So yes, we are constrained by space and time, but don't underestimate the power of good explanation to keep people's attention for longer than sometimes you think you can. And it's so critically important, I think, especially when we are talking about when the chance of stigmatizing groups is as high as it is in this particular topic, because without that explanatory story, you are leaving all kinds of space for people to be able to fill in your communications with stereotypes and harmful understandings of people who use drugs. Any questions or comments about that particular? I'm gonna take out my earbuds because I think they just died, but I'll give you guys a second for.
More, I would just, I'm again, I think just repeating what you're saying, but I think as much as we talk.
And here's just another example of how you might build more explanatory power. This is some work we are doing with the ACEs Aware initiative in California, which, obviously you guys are very familiar, but the parental incarceration was originally classified in the original ACEs study as a household dysfunction. And so again, providing more information, especially when people are talking about racial disparities in the experience of ACEs, that really bringing that societal context story into communications is so important, so that again, we do not inadvertently support people's racist and stereotypical thinking about people who are just as impacted. Something is happening in the chat? Let me see.
Can you hear me, Moira?
Oh, Phil, were you saying something? Because I was having issues.
No worries. One thing that I want to note, and you've been very influential in this regard, is that when we want to understand the why, oftentimes the quantitative data that we have are inadequate and insufficient to help us understand. And qualitative data has been incredibly helpful for us once we have a finding in kind of filling out some of the uncertainty. I think sometimes we're tempted to just say, well, we found what we found, we can't say why, and we don't want to be sort of over-representing what our findings are. But the risk of presenting non-contextualized results, which you've just described in terms of how people fill in the blanks, oftentimes it seems like one way to get to some of the why is to follow up with a subset of people and ask them to explain what the results mean to them. And a lot of times, especially if it's the population in question, the answers are like pretty evident to them. And it's not that complicated, but I think it's a way of elaborating on the information that you're getting, which is, I think, a more satisfying solution than saying, well, we're scientists, we don't have the why, so we're just going to report the what, and then it's not our responsibility where it goes.
Yeah, and I think that not, and I'm very sympathetic to the we don't have a deep sense of the why, but particularly on this issue, leaving out the why can really cause harm and can contribute to, again, all of the stigma that you all are trying to combat. Any other thoughts? I think I have one more recommendation to share. And these are to be cautious of some backfire effects. So the first is that retraction strategies. There's a lot of misunderstanding, misinformation, disinformation, misperceptions around drug use and around parenting and drug use. And so a common strategy is to say, you think it's this, but it's really this. And the sort of the way that this often shows itself, and especially in advocacy communications, less research communications, are myth fact sheets. And there's now a whole body of research on how these backfire. So one of the more famous studies showed that this communication about the flu vaccine that you see, that a good portion. So what researchers brought young people into their lab, asked them to read this myth fact sheet, then asked them some questions about what they remembered. Lots of people misremembered the myth is true. That effect got worse over time. And the kicker of the story is that there was a good portion of the sample who said, misremembered the myth is true, and then attribute that information to the CDC. So came out of this study, the CDC says the flu isn't a very serious disease. And this makes a lot of sense, right? If you're thinking about human cognition, you're literally reminding people of the very thing that you don't want them to think about, which can support those thoughts. I think it was after Trump's his first State of the Union speech, where he, talked a lot, really sort of anti-immigrant rhetoric, and talked about gangs and MS-13, and people were doing word counts of all the times he said MS-13 and gangs. And I had it was a reporter from USA Today called me and wanted to talk about that. And I said, what the most damaging part is people who want more expansive immigration policies, and, Democrats who responded said, he would have you think that all immigrants are criminals, but You just did his work for him, right? So I think one of the really important things to think about is make your affirmative case first. If you can leave the myths alone, leave the myths alone. If you really do need to correct misperceptions, at least just do it second. And again, there's this sort of genre of communications is all over the place. So fact checkers, I'm going to tell you the thing that you think is true, but it's wrong, and then I'm going to tell you it's wrong. Those just backfire. Empathy may not be enough to get people to support the kinds of evidence-based policies. So what I'm showing you here is a study that we did on substance misuse in the province of Alberta. In this study, the setup is we gave 3 different groups of people 3 messages, and we have a control group, that's the black line. So one group of people got the message of interdependence. We're Albertans, we're in this together. If one part of our province is experiencing something, it impacts us all. So if people are having difficulties with drug use, we really need to make sure we have the system of care in place to support them. Next message is one of ingenuity. We're resourceful people. This is a tough problem, but we've overcome tough things in the past. And if we put all of our good thinking, all of the evidence that we know, we can again create the system of care that'll better support people who are using substances. And the final message, and again, this was the message that lots of the folks we were working with were sort of coalescing around, is empathy. So people who are using drugs are people just like you and me. We really need to be compassionate, and that's why we need to invest public resources into the system of care that we need. And here's what happened: that empathy message backfired. And the reasons that we, again, later stages of the research that we found out is what it was actually doing is sort of activating people's highly individualistic ways of understanding. So people became very focused on a single person. And that, again, maybe they felt more empathy, but that empathy did not necessarily translate into people's policy support. At the same time, so this is, we also find that rights-based messages can backfire. And so a lot of the folks that we were working with when we were doing the research on harm reduction, we're really relying on, respecting the human rights of people who use drugs. And what we found on that project, and I'm showing you a project that we've done on immigration, was that a humanitarian argument, sort of a moral argument. People are people, and this is why we should be doing things in the way that change things, was more effective than rights-based messages. We've been testing rights-based messages on issues related to children, on immigration, on criminal justice reform, and they never work. And I think the real reason is that people, rights need to be explained and not asserted. People don't have a robust sense of what rights are, so that if that, I don't know if this is necessarily pertains to you, but we see a lot of rights-based language in sort of advocacy for drug users that, again, we have pretty good reason to believe that might backfire. So I am going to stop there and open it up for any questions or comments. And again, just to have a discussion of what any of these strategies might mean for your own work and research.
Moira, I just wanted to let you know too that I think folks might be dropping off because we may have not given quite enough time for this presentation. But so just so you know, that's why. But and I have to jump off as well. But I also wanted to say thank you. No,
I thought I had to. I'm so sorry. I thought we were on till 4. So I'm sorry for going over. Thank you. And I didn't.
I could listen to you talk all day about all of this, and I'm so grateful for your time, and I just really excited that we were able to do this too. So, but I also didn't want to since you've got some time carved out, so I feel like if there's other folks who want to stay on and ask questions, they're the lucky ones that had the extra half hour in their day.
Well, Camille, maybe we could also just send out a follow-up to the folks that were in attendance so that if they have additional questions, we can send them to Moira, and either she could do a quick response by email, or if needed, we could schedule another quick follow-up time.
Yeah, and I think I had a bit of a time zone confusion too. So I do apologize for going on so long, and I'm happy to answer any questions and send my slides around and all of that good stuff. Thanks guys for staying on.
Great.
Thanks,
Really good.
Moira. Yeah, Ashley will send out something to the folks who attended asking for if the folks have any questions, and we'll compile those for you, Moira.
Okay, thanks guys.
Thank
Good
you.
to see you.